Hello, my name is Cam Bean. Today, I will be presenting a topic that applies to all humans, death anxiety. With the conclusion of this presentation, you should be able to understand what anxiety is and specifically what death anxiety is. You should also be able to understand the causes of death anxiety in humans or things that may put a person at higher risk of suffering from an excessive amount of death anxiety. Next, you should learn the impact that death anxiety has on a person. And finally, you should understand that since we are all human beings, anxiety about how we die and death itself applies to all of us. Anxiety may cause internal feelings of tension or excessive worry, as well as recurring intrusive concerns. Physical changes include increased blood pressure, sweat palpitations, or nausea. Anxiety may lead to avoidance of circumstances altogether in order to reduce that anxiety, and the internal changes may lead to a change in behavior. For example, SpongeBob, when he was injured, didn't want to go outside because he figured that avoiding everything was the best way to reduce his anxiety. Death anxiety refers to people's anxiety or even fear of death in the process of dying. It is largely unconscious due to the fact that it's such a complex and dark thought, so we push it to the back of our minds, a process called repression. The unknown nature of death makes us uncomfortable, leading to this repression, and death anxiety actually plays a root for many anxiety disorders, as the fear of death is the root of many of our fears. Young adults begin to be exposed to death and know the process going into the real world. Going into the real world brings things like taxes, possible children, spouses, and definitely death. The reason that death anxiety peaks again around middle age is because loved ones, close friends, and maybe even family members begin to pass away, and the next stage of life is older adulthood. We all die because we are human beings, and accepting morality and that we will not last forever is the first step in coping with death anxiety long term. Death anxiety impacts us all because we either consciously think about death or we repress the idea of death in order for our brain to continue normally functioning. What you have seen, lost, or been through, and how you handle these things play into shaping your personal experience with death. Excessive thoughts of death can be the cause of an underlying, undiagnosed mental illness. Trauma, life-altering events, or even a near-death experience may increase the risk of death anxiety in an individual. Personal loss of a loved one or a family member or someone close may also increase the risk of death anxiety in an individual. Cultural and spiritual differences when it comes to the view of death and what happens to the soul and body upon death may alter the perspective of death in an individual as well, causing more or less death anxiety. The terror management theory explains the issue of people engaging in certain ways to reach a concise psychological state based on these deeply rooted concerns about our morality. TMT leads to behavioral changes and attempting to preserve one's life and achieve successful survival. Old people do remind younger and middle-aged people that death is real, and this is what causes a lot of the anxiety. Death anxiety could lead to anxiety itself, depression, post-traumatic stress disorder, or something called illness anxiety disorder, which is the excessive preoccupation with having or developing a mental illness or physical illness, fear or belief that one has a serious disease based on their present medical state. Overthinking about death, whether this is caused from an outside event or internal feelings, leads to onset of mental illnesses in many cases. Illness anxiety is debilitating and causes great dysfunction in people that suffer because of these unwanted thoughts. Finally, illness anxiety disorder and people that suffer from it are often impacted because it's costly from switching to doctor trying to figure out what is wrong with a person. Purpose in life and fear of dying are negatively correlated in high school and college students, retirement community residents, and people with disabilities or terminal illnesses. With an increased purpose in life, fear of death goes down. Decrease or struggling to find one's purpose in life makes death anxiety increase. The score of thoughts of death anxiety is higher in these individuals, as the study demonstrates the trend of how people with low levels of searching for meaning generally have lower levels of anxiety related to death and dying. This is why it's so prevalent in these demographics of people, because they're searching for a meaning in life, and this is why it is causing more death anxiety, because they're thinking about how their life will end. So not searching for meaning in life and just living causes less death anxiety, but people who report searching for meaning in life tend to think about death and how their life will end. Older adults encounter various challenges in their day-to-day life, especially because of inescapable and unavoidable process of age-related decline. The realization and increased acceptance of death as age-related normative event is a lot more normal for older adults. Older adults do experience the inevitability of death approaching. However, it is not as prevalent and does not cause as much anxiety as in younger adults or middle-aged adults. Robin Williams suffered and had death on his mind when he died of suicide. He demonstrates how externally and physically a person may appear to be happily living, but internal thoughts are often hard to escape, especially without treatment. Emma Stone discussed openly in her article with Express Magazine in 2012 how she has been hyper-aware of her death ever since she was a young girl, and she has had a great fear of dying and morality of herself, as well as humans. Finally, Jared Higgins, more famously known as Juice WRLD, wrote and sang about death and dying a lot in his music. Higgins died of a drug overdose last December at the age of 20 years old. One album of his was even titled Death Race for Love. Death education programs help to alleviate stress when it comes to death. They also help to decrease the emotional response and sensitivity to death. Cognitive behavioral training involves changing thoughts of death and replacing them with more positive thoughts, rewarding behavior in thoughts that do not involve death. Medication, such as SSRIs or anti-anxiety, can also help to decrease thoughts of death, as they target neurotransmitters that aid in thinking positively. You should never be ashamed or cautious about talking to your doctor about your mental health. If you feel like you or someone you know have excessive thoughts of death and it impacts the way you live, you should seek treatment. These are some helpful resources when it comes to thinking about death and how to manage your thoughts of death.